Welcome to Health Facts with Normanie Ricks. I am your host, Normanie Ricks. I like to start off each episode with a little known health fact. Have you ever heard of complex regional pain syndrome? Most people haven't. It used to be called reflex sympathetic dystrophy. But what happens is a person has an injury or an accident and they have a lot of pain in a certain area of their body. And then sometimes it tends to spread. And it's just basically a pain that never goes away. So it really, really affects people's quality of life. I have the distinct pleasure of having two guests on my show today that have complex regional pain syndrome. One's name is Shannon and the other one's name is Lily. So I will get started and introduce these lovely ladies to you guys. How you doing?
How are you?
Awesome, awesome, awesome. So Shannon, we will start with you. How did you get diagnosed with what also called reflex sympathetic dystrophy? How did this happen?
I was 18 and had an emergency appendectomy. And after that surgery, I never felt right. And so I started going to college and felt okay. And I was a piano major. So, being a music major, a piano major, you're practicing literally every hour of the day.
Right.
And I woke up 1 week to the day after my 19th birthday with a pain in my right hand that it hurt. I couldn't use my hand. It swelled. It was awful. And I went to the nurse and told her about it. And she's like, we'll watch it and see how it goes. Ironically, my piano teacher, who was a Russian, she was 80 some years old when I had her. She thought I was trying to fake getting out of playing that day because I had an exam. So I went to the doctor. They diagnosed it as carpal tunnel and immediately did the surgery like 10 days later. While I was home recovering from that, the pain did not ease at all. And it started in my left hand. Same symptoms, everything. The doctor said, I'm not going to wait, we'll operate. So in March, I had that surgery. While I'm recovering from that, then it spreads to my left leg and right leg, all within like a 4 to 5 week span.
So I feel like that's shocking. A lot of people don't know that this pain that didn't even happen in this area of your body can spread to different parts of the body. That is
I thought I
scary.
was going crazy. I mean, I literally thought I was nuts. Here I am, a healthy 19-year-old college student. All I want to be is a music major, and my life is now doctors and this, that, and the other. They diagnosed me correctly. They did a phone interview. I had doctors affiliated with Johns Hopkins. They did a phone interview on a Monday of 1 week, and the following week, they admitted me to the hospital. I went to the doctor. They said, you have RSD. We're going to treat you with massive doses of steroids. You will not, you won't be able to finish college. You won't be able to get married. You won't have a child, blah, 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 blah. And I was like,
did you have any family support with you at the time? Like, was your mom there?
My mom and my dad. I do have two siblings, but they're older. So they didn't know either. I mean, their life was rocked too. And everybody kept saying after the carpal tunnel, she won't have any more pain. Well, I did. Yeah. They did treat me with the steroids, and instead of helping, it made it worse. So we've had various surgeries and things over the past. My arms are now okay, but there's this intense burning, sharding, exploding pain in both of my legs. I cannot have blankets on my legs because they hurt. My dog sitting on my lap, she weighs 10 pounds. I can't have her on my lap because that hurts. I don't sleep. It's a pain that does not go away. It's a burning pain. I call it the beast. And I actually had a doctor with one of the most prestigious hospitals in the country call it a catastrophic illness, which that really stuck with me because when you think about a catastrophe, you think of a hurricane and the damage Katrina did. That's my life. I mean, RSD does not only impact me, it impacts my parents, my friends. I can't work anymore. Right. I go to a doctor's appointment I literally have to take all day to prepare for it, and then I'm down for 2 or 3 days. So
Wow.
it's difficult. And the biggest thing I can say is have a support system. Hang on to those people who really know you and believe, who have your back.
Right.
You know, I have a small circle of friends. I have doctors now that I do trust, and that's hard. But it's difficult. It is difficult.
Okay. So we're gonna go into Miss Lily Cinnamon. What's your story? How did this happen to you?
So I was around the same age. I was 21 in college. I was in the hospital. Sorry. I was in the hospital. I wanted to get a CT scan on my head because I fell the night before. So I was in the ER, and they were trying to start an IV or at least take blood. And I was kind of like really out of it because the whole idea was I was in there for a possible concussion. And I kind of was just like handing out my arm, like take blood, like not really paying attention. And she takes blood from like right here. She sticks the needle right here, which is my median nerve. And immediately I had pain. I was icing it for the rest of the visit. I don't even think they took notes on what happened. But immediately after I was like, something is very wrong. I couldn't shampoo my hair. Like everything that took 2 hands was really hard to do. So typing was really hard. Thankfully, I still had my right hand, which is my dominant hand, but everything became that used 2 hands became so difficult, and I would do it with one hand. I went to my primary care physician. He referred me to like, he didn't even know what types of doctors to refer me to. So like, I think he referred me to a nerve doctor who put me on steroids, nortriptyline, and then kind of went that whole route where I was just taking a lot of Advil, and he was going to do these nerve conduction studies, and these CT scans. The nerve conduction studies made it worse because they literally use needles in the spot where you have the nerve damage.
Right.
But everything came up as like there was like signs of inflammation with the CT scan, but nothing showed anything really like severe. Like it didn't show like that the nerve was cut completely or anything like that. So I was told that it was carpal tunnel syndrome. And then I kind of went through that whole semester of school because the hospital visit happened in June. And I kind of went through that whole semester. I applied for disability services at college. I kind of did everything with my one hand. I had to drop a few classes, but I pretty much spent like the whole year just going back and forth to doctor's appointments and traffic because they kept referring me to different people. And then I tried PT, it made it a lot worse. And I kept being told like by one doctor, like, oh, it could be CRPS, but I really know nothing about it. And then by others, like, there's no way it's that, absolutely not, no way. And I also was trying to get a lawyer to get like money from the injury, which no lawyer ever took my case because I never had a diagnosis before the year.
Yeah, so I think that I was very shocked when I heard Shannon's story and she got diagnosed in 2 months. Was it less than 2 months? That's unheard of. So usually it takes a very long time for people to agree on a diagnosis when it comes to CRPS because it can present in so many different ways on so many different people. So Shannon, can you talk a little bit about like what it looked like? Like, was it inflammation? Was it throbbing? Was it red? Like, can you talk about what your hands and feet look like?
My hands were red, my feet were purplish black, and they are still purplish black, ugly. My hands and arms were swollen, and I could not, like, my right hand was like this even after carpal tunnel surgery. And I remember walking into the doctor's office with a blanket wrapped around my arm because the breeze hurt, but yet I was hot. And so, you know, we're having fans on and I'm still hot, but then the breeze from the fan hurt. And that I think was the kicker with them that made them realize that it is RSD. And I went to the grandmother of rheumatology back in 1990 And they diagnosed it, like I said, when they did the phone interview, and then the minute they saw me, they said, this is what you have. I've
Yeah.
seen other doctors, they'll say they hate that diagnosis because it can present in so many different ways.
Mhm.
And hate is a strong word, but we all know how difficult it is because it presents so many different ways. And the thing that I keep saying is it's burning, sharding, exploding pain. It's that burning intensity and quality of the pain. So
Right.
I think the hypersensitivity and the way the red and the black, and then the burning pain, that's what really triggered them to diagnose it correctly. And I'm very thankful they did.
Right.
Even though it was
Go ahead.
correct and they did the treatment known about it in the early 90s, that may have done more damage than good, but still I'm thankful they diagnosed it correctly.
Well, what is the current treatment? Lily, what current treatment are you getting for this condition? Because I know back in the days it was steroids.
So I did CalMAR, which was kind of the regular medical system, but I kind of didn't want to go the route of ketamine and spinal cord stimulators. And for a while I was on all those like gabapentin, pain medicine and nerve medicine, but I actually moved to Arkansas because there was a chiropractor here that was like healing the vagus nerve, and she specialized with CRPS patients. And it's usually just like a couple month program she did, but I just ended up moving here because I didn't have a life before I came here, and now I do. Even though I'm still in pain, I'm able to do things for myself and live by myself and stuff.
So what did she do for you?
She does vagus nerve stimulations, and then they have a lot of other things in that program, like physical therapy, using like electrodes,
Mhm.
like microcurrents. They
Mhm.
do a lot of stuff, but it's kind of the idea of it is giving your body the opportunity to heal itself. So giving your body the tools to heal itself, because our bodies are like programmed to survive, and something's stuck if we're like creating pain and getting sick and not like being well.
Right.
We're just trying to survive.
Shannon, did you have anything to say on that?
I know a lot of people who've done the CalMAR. I know several people who are doing ketamine and are getting, that's a mixed bag. It does seem to help for a while, but doesn't. Each person's different. I'm just the old dog. It's hard to get, the new tricks to me because I've had it so long. And I've had the spinal cord stems, I've had the DRG. The biggest thing that helped me, I had an intrathecal pain pump for 14 years. And that helped because I got medication literally 24/7. They explanted that though 4 years ago, and things have been extremely difficult since that has been explanted. So we're going to try maybe that route again. But then that's surgery. So again, you're tossing the apples. Do you go through a surgery with a possible flare, or do you do it in knowing that your body may allow you to get back to functioning the way you used to? So that's kind of where I am with that.
So you talked about flare. So that's usually used, the terminology usually used for like if you have rheumatology situation, like rheumatoid arthritis, fibromyalgia, stuff like that. So I guess there's a history of these types of diagnoses where people just think you're crazy. So, so this is why I wanted to definitely bring you guys on and bring awareness to this condition. But like, Lily, I wanted to ask you, like, it started in one hand and they kept poking and prodding in that one nerve. And then did the pain move to different areas of your body?
So within 9 months, 8 months, it moved to my other arm too, which is when I had to stop school. And then it moved like into my stomach. And then eventually it moved into my lower body too. But my hands were so bad that my hands and my stomach were so bad that's kind of the focus. But I do remember like I used to also get like burning in my ear and my eye, and like I'd get ringing in my ear all the time, and I would go to like all these doctors, and no one like realized that it was like like in my organs, like in like it affected my whole body. It wasn't just pain in one area.
Mhm.
Um,
So Shannon, can you talk a little bit about how and why and what has been explained to you? Why does it spread to other parts of the body when that's not even what was injured?
That is the $1,000,000 question. That we still haven't figured out, I don't think.
Mhm.
I do know that, like, as a child, when I went back, like history and reviewed, I had TMJ as a child. I had really bad migraine headaches. And all of that is part of RSD CRPS when they go back and look at the research. Um, and each time things would be different. So, like, I still deal with TMJ issues
Mhm.
and the migraines, but as to why it spreads, that I don't know. I mean, I'm still trying to find that out too, and the doctors don't know.
Mhm.
And getting back to when you asked Lily about people thinking you're crazy and this can't be. I had one nurse say to me, "Are you really in that much pain? You can't be. You look nice. You do your hair, you do your makeup." And I'm like, "Time out. I want to look like I'm okay. I don't want to look like I'm sick.
Mhm.
I am Shannon first, not RSD first.
Mhm.
And even though I'm not working and I'm really in the employer setting, I'm doing a lot to raise awareness, because that is so key. You may look like you're okay, but my body will pay for a doctor's appointment tomorrow for the rest of the week.
Mhm.
And so people need to realize that this is a debilitating disease and it can impact not only you, but everyone else around you.
Yeah.
That didn't answer your question about a flare, but or the why it spreads, but that's something I, I don't know. I mean, I wish I did. I wish I
Right.
could go to Merlin and say, hey, or somebody, and just ask that question, because we know more now than we did back in the dark ages when I was diagnosed, but we have a long way to go. Long way to go.
Yeah. So Lily, when you said that you moved to Arkansas and now you have your life back, can you kind of talk about that a little bit more?
I wouldn't say like I have my full life back, but I'm kind of living a life that I never thought was possible when I first got diagnosed and when it was really bad. Like, I mean, if you can't even turn a faucet on or open a door, you're not ever going to think that you're able to live on your own.
Mhm.
But like I use like a lot of like medical devices. Like I'm constantly hooked up. I'm not right now, but like to like microcurrents and stuff. And then I eat a strict like gluten-free diet, on a lot of supplements. I try to stay moving. I do physical therapy, and I just try to eat really nutritious,
Mhm.
and anti-inflammatory.
Right.
Um,
So what supplements have been recommended to you that may possibly help?
I'm on a lot.
What's the number one and number two?
I think it's different for every single person. I don't think like I can really recommend a supplement to help everybody because I think it's very different for everybody, if that makes sense.
Okay. Well, I
Um,
know like vitamin D is supposed to help a lot of things. So, and I know inflammatory process, it helps with that. So, Shannon, do you have anything that you've heard over the years?
Vitamin D, sunshine. That's the easiest way to get your vitamin D. And I had my levels checked, and I used to tan a lot because I had a doctor say to me, why don't you go to a tanning bed? You're cold all the time. That would get you warm. And I'm like, okay. And she said that would spike your vitamin D levels.
Mhm.
Again, this was back in the late 90s, I think, early 2000s. And I did. And being in that warm, oh my gosh, that was wonderful.
Okay, good.
Um,
Good, good,
but
good.
and being out in the sun, because like I said, I am so cold all the time. I love hot weather, but I hate air conditioning.
Mhm.
So, I'm literally walking around with a cardigan or something, because when you go out, or I'm upstairs in the air conditioning, that bothers me. So I'll go outside and sit in the sun. Easy way to get your vitamin D.
Right. Shannon, are you able to exercise? Are you in too much pain?
Um, I I did walk every day. And that was my therapy for me, but I have not been able to for quite a while. I actually broke both feet. And so as I have osteoporosis as a result of the steroid treatment back when I was younger.
Mm,
Um, so I haven't walked since then, but I want to start doing that again. I just think that's good mental health as well as keeping the limbs moving.
mhm.
And even though there is a lot of pain with it, I'm going to have to push through it and know that it may hurt, but it may help too, if that makes sense.
Well, have you tried like an exercise bike?
I have, that's boring. I'd rather be out walking and see. I love to just walk and
Sure.
just talk, see people and
Yeah.
turn the music up and just go.
Right,
Um,
right. That's part of our like mental health and well-being too. Getting out, socializing, seeing nature. So I definitely understand that. So Lily, I just wanted to kind of ask you with your age, like how is your social life?
I just remembered something about the supplements.
Okay, go ahead.
So vitamin C,
Mm,
not something, it's something I take every day, but just like the vitamin C that's like in liquid form, if I'm going to like, that's what you're supposed to do before you have surgeries and such, and to take that before surgeries or just every day, it's good for CRPS. I just wanted to throw that in there. But for a long time I wasn't driving, so that was like really hard, like meeting people, and I had really like bad noise sensitivity and light sensitivity. Like I wouldn't have even been able to do this interview or be on this podcast um like 2 years ago.
oh, wow.
But I've just kind of put myself out there and made friends, and I don't really introduce myself with CRPS anymore like I used to when it was really bad,
Mhm.
because I had to kind of.
So let's talk about the mental health aspect of all of this. Miss Shannon, have you had to get any mental health therapy as a result of CRPS?
I have, and again, back in the dark ages, that's just the way I feel. Because there are a lot of people that have not had RSD CRPS as long as I have. So when people say, how long have you had? 32 years. It's kind of mind boggling for me. So yeah, I did. I had a hard time accepting it.
Mhm.
Um, because I was so young, I wanted to be a music therapist. That was ripped from me. I did finish college. I was able to work, but it takes a toll. And when you have so many things coming at you, and you see your friends living their lives and teaching and doing what they want to do and going out, and just not being able to be who you are.
Right.
um because for so long, like I said, I felt like I had to put on to say I was okay, but even though I wasn't okay. um and RSD CRPS is known as the suicide disease,
Oh,
which
wow.
when I found that out, I was mind boggling, but I totally understand why it is. Um, you are in so much pain that you don't know which way to turn. And a lot of people don't want to reach out to a mental health counselor,
Mhm.
because of the stigma attached to it. But if you reach that point, or if you call, seek help, it's that's an important part of it, because again, RSD CRPS impacts every avenue, every aspect of your life. And again, those around you.
Okay. So Lily, I want to ask you that same question. Have you sought out mental health?
Yeah, I know in the beginning, like in order to do like ketamine treatments and stuff, they literally like had to go through like these mental health evaluations. But I found like speaking to a therapist like made things worse
Okay.
in some ways, because I was like focusing on what was going wrong. And it's like I felt like I was trying to explain it in a way they like didn't understand it, because it affected so many avenues of my life.
Mhm.
So currently I'm not going down that route, and I've been doing better because of it.
Okay.
just because I feel like when I was going down that, I was focusing on what was
Focus
going
and you're
on.
hyper focused on the pain and how it was
Mhm.
affecting your life. I get that. I definitely
'Cause
get
I
that.
don't like talking about the pain. Like
Right.
I kind of keep it on the back burner and I don't try to focus on it, because if I focus on it, it becomes my whole being. And I felt like in therapy, we were just talking about everything that shouldn't be on my mind.
Right. So what have you done to, I guess, take your focus off of it? Is it like positive affirmations, meditation? Like what has helped you?
Just positive affirmations, just thinking that like I am really lucky to be in the position I am right now compared to I used to be, or where I used to be, and just like that this didn't necessarily like happen to me. Like I'm not the victim in this scenario, because like even though like it sucks and it's awful, like I've learned a lot of things and became a stronger person, and like I have more tools at my disposal now than I've ever had and probably ever would get like at this young. Like I wouldn't have had all these life experiences and that type of stuff, and it's just something that like I'll have to deal with and I'll have to manage. But everyone kind of has their things everyone kind of has their things they have to deal with and they have to manage. And even though like sometimes it really is a nightmare having CRPS, that doesn't mean like there's not hope for me in the future, and hope with CRPS, and that I can't make a difference for other people too.
Wow. Yeah. Thank you so much for saying all of that. Miss Shannon Leidig, is there anything that you want to say or leave for our audience? Thank you so much for being brave enough to come onto this platform and tell your story. Is there any words that you want to leave with?
You know your body. If you're in pain and something doesn't seem right, let people know. Don't take no for an answer. If you know that something's wrong, you know your own body better than anyone else. Have a support system. And me, my circle is small, but that's okay because I know that they'll have my back. Just I'm working really hard to raise awareness, letting other people know that's the only way that we're going to make a difference and get the research and to find something to tame the beast of RSD CRPS.
Right.
And just programs like what you're doing, this is so key and important in today's world. Everybody does podcasts and things on Zoom and internet. This is great, and I just applaud you guys and thank you for your willingness to take the time and focus and do something on RSD CRPS. So thank you very much.
You're welcome. Miss Lily Cinnamon, is there anything that you would like to say to the audience?
Well, I'd like to piggyback off of what Shannon said. You know your body better than any doctor knows like what pain you've been and what's going on in your body. Like you have to be the advocate of what is going on, and like no one's going to take the reins on that besides you, and you need to stand up for yourself. And like sometimes it is really hard navigating finding the right doctors and the right treatments, but if you don't advocate for yourself, you'll easily like go on the back burner. um
All
uh,
right. Well, thank you so much for being a guest on Health Facts with Normanie Ricks. You guys take care.